it, get it out. Whoa, he has trouble with the snap, and the ball is free. It's picked up by Michigan State's Jalen Watts Jackson, and he scores on the last play of the game. Unbelievable.
So you've decided to go to college at Michigan State University, and now you're stuck on your next big decision, which is what to declare as your major. Although everyone is unique, if you have an interest in the medical field or sports, athletic training may be for you. For those who are unaware, athletic trainers, not to be confused with physical trainers, are highly qualified, multi skilled healthcare professionals who collaborate with and work under physicians to provide preventative services, emergency care, clinical diagnosis, therapeutic intervention, and rehab of injuries and medical conditions. Athletic trainers, or ATs for short, may have various duties and responsibilities based upon their place of work and patients. ATs could expect to do things on a day to day basis, such as applying therapeutic modalities to a collegiate athlete, to ordering equipment and organizing documentation. To gain more insight on what a career is all about, I thought it would be best to interview someone in the field itself. So I reached out to a well accomplished professor working here on campus to ask a couple questions, and here's what he had to say. So we have Tom here. Thanks for doing this interview. So what I'd first like to ask you for our audience is, how did you get here and what have you been doing in your tenure at Michigan State University?
Okay, that's a long, long story. Ian. Began here probably 29, 30 years ago, 1987. Arrived here as an athletic trainer following University of Detroit. Was a head athletic trainer at U of D. Came down here to work exclusively with men's basketball. Coach Heathcote. Worked with basketball clinically for 25 years. And then the last 5 years, I went to Jenison 5 years ago to work with men's women's ice track and men's women's golf. And from that, I evolved into the clinical education coordinator, which is what my current role is here in athletic training. In the past year, I've been predominantly involved almost 100% with clinical education for the athletic training program. In my office here in IM Circle, and work the clinical environment with our students in the athletic training major.
So when you have a job, there's the location, accommodations, and other factors. How do you feel when about your career choice when you come to work every day? How satisfied are you with your career?
Oh, very satisfied. I mean, Michigan State's just a great place to be. I've been here forever, and there's a reason for that. I think there's a lot of people that visit Michigan State that visit and stay, and I think that says a lot about the university, the people, the academics, the combination of it all. Location, but no, it's a great system. Love coming every day. I don't pursue it as work because every day is different. Every day is opportunities to do something new with different people, and I think the bottom line is it's just a great, great location, person or place to be. And my job, I truly enjoy what I do every day with the students.
Okay. And last, what do you feel, if anything, is unique about your field and or the people you work with?
Wow, tough question, Ian. Unique is interesting because I think we have a healthcare profession and field that nobody really understands. We're not physical therapists, but we do physical therapy. We're not physicians, but we are working with physicians daily. We work with 20 or 30 different specific medical health clinicians, and I have knowledge in all those different fields. We're the only healthcare profession that can take care of somebody when they're injured at the beginning or prevention mode before they get injured, unfortunately, to when they're fully injured and to the rehab phase to return them back to activity. We're involved in activities with athletes, coaches, administrators, parents, guardians, friends, families, peers. I think we evolve in all those different aspects, and I think it's unique in a lot of different ways that we can offer help to a 2-year-old to a 92-year-old, somebody who's physically active, and also not just athletic based. It could be non-athletic issues, working in clinics, hospitals, Cirque Soleil. It could be working with the Navy SEALs. We have all sorts of wide gamuts for our job opportunities in this profession.
Thank you.
Sure.
Something Tom said that should be discussed is job setting. An alluring factor the athletic training major has is its hands on approach in the curriculum. Not having an interest in sports should not sway someone away because there are many different jobs available that are not sports based. In addition, just because you received your undergraduate degree in AT doesn't mean your options in healthcare are more limited. A respectable amount of athletic training majors aim to ultimately become physical therapists, physicians, and other professions in health. Grades are the biggest determinant above all else when schools are viewing an application. In conclusion, if this major interests you, you should go directly to advising at the College of Education in Erickson Hall to learn more. Michigan State is great at recruiting and developing elite athletes, but sometimes things take a turn for the worse. However, with one of the nation's best athletic training programs around, it helps that Spartans can be assured athletes are well tended for when those things do happen.
With the travel, what he's doing here is he had the traveling violation so Aaron Harris can come over and participate in the Michigan State tradition where the seniors kiss the mid-court area of the basketball court. Kiss the floor right at midcourt.
No matter what you decide to do, remember, enjoy your time in college and go green.